I'm a geriatrician, and I love taking care of older adults. I enjoy getting to know them, learning their histories, and hearing about what they've accomplished during their lifetime. Usually when they come to me or I see them, they are having difficulties of some sort. And I really enjoy working with the patients and their families to help them understand the nature of their conditions, learn about them as people and what's important to them, and then work together with the patient and the family to make a treatment plan that makes sense for what's going on with them medically and meets their needs as best as we can, keeping in mind what's important to them. As people age, they tend to develop a greater burden of chronic medical illness. And what we have learned is that older adults, the very people who have the highest burdens of chronic medical illness, also have the lowest levels of health literacy. And so the people who really need to interact with the healthcare system effectively are the least likely to be able to do so. One example of the gap between what people need and what they're able to acquire is that older adults who have low levels of health literacy are unlikely to use the internet to try and find information about their medical conditions or how to access care. It's critically important for all healthcare professionals to fully appreciate the depth and the scope of the problem of low and limited health literacy with the people that we're taking care of and trying to help. And we have to work diligently and communicate very clearly and effectively. And there are strategies that can be used to make sure that, in my case, my older adult patients and their families truly understand what it is we're trying to accomplish and the reasons why it's important. This is a very exciting time to be a geriatrician at the Medical University of South Carolina because the leadership here at MUSC has made a substantial commitment to not only improving the health care that we provide at MUSC for older adults, but also to do so in a way that truly improves the health of older adults in our community. Dr. Atul Gawande has written a very popular best-selling book called Being Mortal, Medicine and What Matters Most at the End. And what he talks about is that what people most want, even when they can no longer get better, is to have the ability to shape their own story. With the growth of a geriatrics program here at MUSC and with the opportunities and the type of work that we're going to be engaged in, I truly believe that it's going to be possible to help people shape their own stories even at the very end of their life.